seeing your piriformis muscle here. Of course, this is your gluteus medius, and that's your gluteus maximus there. Okay, piriformis. So that is your superior gluteal artery. Okay, this is your sciatic nerve, and you can see that sciatic nerve run all the way down the back of the leg. This is the best model for the sciatic nerve. That one's not as good because it's showing you sciatic nerve right here mid-thigh. This is your lateral side, and this continues on. So this is your common peroneal nerve, and this continues as tibial nerve. And now you can see the popliteal area here, popliteal artery, popliteal vein, running right with that tibial nerve on down. Now the models don't show you the supracutaneous nerves. You can see that on wet tissue. When I take this one off, you'll notice that this model doesn't show you the division of the sciatic nerve. It's just sciatic nerve, and then it doesn't split, doesn't do anything. So that's why I feel this model is better for that. Now, what I want you to see here is that beautiful adductor hiatus. Look how you can see this huge muscle right here is the adductor magnus. This is your femoral triangle area. So you're seeing your common iliac, internal iliac, external iliac, inguinal ligament. Then you're seeing your femoral nerve, artery, and vein. Then you can see coming off of that femoral nerve, this little string that's running right through the adductor hiatus with the two vessels is the saphenous nerve. Saphenous nerve will always go into the adductor hiatus, ADD, adductor hiatus, along with your femoral artery and femoral vein. Okay? Up here is still femoral nerve. All of these little branches are coming off the femoral nerve. This is the singular branch that's running along with my artery, my vein, through the adductor hiatus. So you can tag that there as saphenous nerve. Okay, so remember that. Okay, now most of these muscles here, I'm assuming that you're still familiar with. See the psoas major here and the iliacus. See how they come together right here as your psoas muscle, iliopsoas muscle is the psoas major and the iliacus together, and they form the iliopsoas. Okay, right here, that small muscle is the pectineus, and this is your adductor longus. This is sartorius. This is your tensor fasciolata running into the IT band. This is your rectus femoris, vastus lateralis, vastus medialis, and then underneath the rectus femoris, you have the vastus intermedius. Okay, so that kind of covers that area. Now over here, this very medial muscle is the gracilis. The gracilis. Okay, so that's kind of a recap of that area. Now, when I turn back here, I want you to notice that these muscles are on your sheet, and right in here, that area you probably didn't study on last semester. Those are your lateral rotator muscles. So here, this is piriformis. Then you see the sciatic nerve. This next muscle is superior gemellus. Then the next one is obturator internus. This is usually very tendinous. Then you have inferior gemellus. Then this square right here looks like a square. That's quadratus femoris. These are your lateral rotators, okay? So you can see that on several models in the lab. Here, this model shows the tendon to the obturator internus. So in my mind, this is easier because obturator internus has a nice tendon that you can see. So you're still looking at all of those muscles right in a row. Piriformis, superior gemellus, obturator internus, inferior gemellus, quadratus femoris. Okay, now let's look here. Here I can see my piriformis here. Now, when I'm looking at my vessels in this area, let's look at our vessels and our nerves. Vessels and nerve. I still use my landmark of my piriformis right here. Then I can see my huge nerve, the sciatic nerve. It's yellow. And then this tiny little branch that's yellow is the posterior femoral cutaneous nerve. Here I can see right here this artery, inferior gluteal artery. Now I can see the internal pudendal artery, and then of course there the pudendal nerve. Now notice how that pudendal nerve and that internal pudendal artery is running underneath this ligament right here. That's your sacrotuberous ligament. Sacrotuberous ligament, and it's kind of running right underneath that. Okay. Now, if we come on back towards that lower leg, just a recap of that, because those are muscles that you probably learned when you took 141. And I don't think all of those are on here. No. See that on wet tissue. Okay. All right. So that's kind of going over these two models. Also, you can see beautiful lateral rotators on that model back there. Let's go back there and look at that dark formis, sciatic. Then again, you can see your numbers, 1, 2, 3. Superior glomerulus, obturated interns, inferior glomerulus, quadratus femoris. So we have several models with that on it. Okay, all right. Now, I'm going to go over